Hello, my name is Fatima-Ezzahra. I am a second year MPH student and a graduate research assistant at the Public Health Education Department. Today, I will be presenting on assessing the natural helper approach to Greensboro's Nepali speaking Bhutanese community COVID-19 challenges. Who is a natural helper? Natural helpers are people who are respected and trusted in their community, who listen well, empathic, and sufficiently in control of their lives. They leverage his or her social network and support to respond to the needs of others. They are individuals who have earned reputations within their social networks as caring and competent problem solvers. There are individuals who are not employed in the helping professions but voluntarily choose to spend part of their time informally helping others. They function as first contact people who provide assistance that may include referring the person to a professional. Last but not least, people to whom others naturally turn for advice, emotional support, and tangible aid. Natural helpers are effective in improving local health behaviors. Specifically, they respond with interventions that are adapted to the cultural context of their communities. They are also known as community health workers, community leaders, community advocates, and natural light workers. They coordinate with non-governmental and governmental agencies in their cities or regions. They empower their communities through capacity building and assist their communities with tangible aid such as money, food, and time. Nepali-speaking Bhutanese refugees are a vulnerable group whose quality of life is negatively impacted by having little to no access to resources such as affordable and safe housing, healthcare, nutrition, employment, and education due to low income status, language barriers, poor familiarity with American systems, all of which have been exacerbated by COVID-19. In April of this year, 5 members of the Bhutanese community in High Point who work at Tyson Foods tested positive for COVID-19. Members of the Bhutanese community who were exposed to work which was spread through their community, putting families at risk, further illuminating the existing health and social disparities. This community needed immediate help. But in the absence of more visible ethnic community advocacy groups and county government emergency response, this community's urgent need became the focus of a natural helper's efforts. Through the use of ethnographic field methods that included participant observation, informal conversations, and photography, I gathered information about the natural helper approach being used in response to COVID-19 challenges. One response to the COVID-19 crisis was instrumental support. Instrumental support was mobilized, including by grant awards through non-governmental and governmental agencies to purchase cultural food items and PPE supplies, and providing financial relief to Nepali-speaking Bhutanese families and other refugee families. Over the course of this pandemic, boxes of food and PPE supplies were distributed to more than 40 Nepali-speaking Bhutanese families in Guilford County. The second response was informational support. Social media was used to address COVID-19 stigma and provide COVID-19 prevention education, updates on city and state guidelines, and COVID-19 updates and on the COVID-19 vaccines. Culturally appropriate infographics on COVID-19 and the vaccines were distributed in Nepali. Webinars were organized with Nepali doctors and healthcare professionals to inform the Bhutanese community on COVID-19. Social media was also used to disseminate information on community food drive events, government resources, COVID-19 testing, and COVID-19 vaccinations. We've learned that natural helpers mobilize resources of associations in their community to sustain support from the system, and they respond with interventions that are adapted to the cultural context of their communities. In times of crisis, the uniqueness of a natural helper intervention is that it relies on a community's natural helping system to be different from a professional system of services. This is the essence of building a partnership based on recognized diversity that would enable a community to grow and thrive. A special thanks to collaborators, the Black Child Development Institute of Greensboro, the Public Health Education Department, and the Montagnard Dega Association. Lastly, I would like to thank my mentor, Dr. Morrison, for her continued support and mentorship.